here we're going to talk about hormones. Hormones and depression, how do they interact? Here are a few ones that maybe you're surprised, are these hormones? Vitamin D, for instance, is actually a hormone. And vitamin D deficiency can cause symptoms of depression. I had one patient who, she was deficient. Once we got that up, within 7 to 8 days, she was feeling tremendously better. So that's just, maybe it's a quick fix, but that was the root cause of her low mood. Insulin, so that's talking about your food and mood, and we'll talk a little bit more about food in a bit. So women are more vulnerable to hormone-induced depressions with our cycles, with having babies, and then menopause, all those hormonal shifts. Carrie will talk a little bit about estrogen, etc. Thyroid. The thyroid can both cause depression as well as depression or feeling low can cause thyroid issues. It's a circular, funny chemistry thing that we need to get to the root cause of, well, is yours a thyroid issue? Let's measure it and let's see. Cortisol, another hormone, we'll talk about that a little bit in another few minutes. And then men have cycles too. Carrie, do you want to talk a little bit about the men?
Yeah, one thing that people forget, now men tend to cycle longer, it's not always a monthly cycle, but if men pay attention, it's more like a 3-month cycle. And they'll notice their testosterone fluctuations, and that can be that it's easier to work out, their muscles are tighter, they may have a little bit more interest in their female counterparts for a short time, and that can wax and wane, and certainly their moods go up and down as well. So they do have a lot of hormones that are cycling, they're just not as consistent as we are, and certainly they're not as many to play with them, but they still do, and it has a huge impact, so we want to make sure. And again, just a gentle reminder, mental health is chemistry, so we can fix chemistry. All the fun other ones. So estrogen and progesterone are the ones that typically when we talk about women and hormones, those are the top two we think about. And people say, well, I went to my doctor and they tested those and they were fine. Well, too much estrogen can create anxiety-like symptoms and make it very difficult to sleep. You can get a variety of temperature changes that go with that, as well as low estrogen. That can do that as well. Progesterone, the same thing. So if it's not in the right balance at the right times in your cycle, then that can have a huge impact on how you feel. But those are just the two, and we forget that there are more. So serotonin is the big one. It's the mood, the self-esteem, impulse control. Anyone who has stared down that bag of cookies can know that self-control can be an interesting thing. And serotonin has a huge piece in that. So when your serotonin levels are up, it is certainly a lot easier to go, okay, not today, cookie. You may choose one, but you may not eat the whole bag. Epinephrine is one that we don't think about very often, but again, it's a big self-esteem thing. So it's like, when you wake up in the morning, you look in the mirror and you think, looking kind of cute. That's the feelings we're looking for with these hormones being up, and when they're not, what you see in the mirror and what the rest of the world sees can quite often be a little bit different. Dopamine is a big one for motivation and attention. We see dopamine is gravely affected in people with attention deficit disorder. And they all are. And that's the thing with mental health. All of it is just on the spectrum of all of these interplaying and where they overlap. So it's just a matter of figuring out which ones are most likely out of whack for you, and then we can pick which herbs or which medications are most likely going to make that difference. So yeah, dopamine's the big one. And the other one that's important with dopamine is it gives you that sense of gratification. So after you've eaten something or after you've done something and you go, yeah, that feels good. And you get satisfied and you're done. Quite often people who have addictive behaviors, the dopamine response is the one that's the problem because one's not enough. And that addiction can come from, it can be the thrill seekers that just have to do that one more ride or just get that extra air or whatever else. It shows up in all kinds of ways. Complex cases need more testing. That's sort of the big thing is we quite often sit and talk to people and then diagnose them with depression or ADHD or anxiety or whatever else and hand them a medication without necessarily looking a little bit further. So that's really another thing we want to drive home. Most of these are testable hormones. And the key with that is to just know when in your cycle to test which ones. That is huge. And sometimes you just have to ask your doctor for 2 different requisitions, speaking mainly to the women here, so that you can go first one round of tests at the beginning of your cycle and another round of tests later in your cycle, so you can really get a good picture of those fluctuations.